So as we were discussing about uh, pedigree approach, in that pedigree approach we have discussed two of the important unclassic inheritance, right? Gonadal mosaicism and mitochondrial inheritance. So there are two more which we need to discuss, and these are genomic imprinting and trinucleotide repeat mutation. So first we will discuss about genomic imprinting. First we will discuss about genomic imprinting, right? So genomic imprinting, first we should understand what is the meaning of imprinting. Imprinting means inactivation. So first we have to understand what is the meaning of imprinting. Imprinting means inactivation, right? Imprinting means inactivation, right? Second thing, what we need to understand here, what is genomic imprinting? Is it a normal or is it abnormal? So we have to understand this point, genomic imprinting is a normal phenomena in our human genome, right? So here we have to understand this point, this genomic imprinting is normal, right? And abnormal genomic imprinting will be responsible for certain genetic disorders which we will discuss in later part of this discussion, right? So first let me describe you what is the genomic imprinting. It's a normal phenomena. What happens in this? To understand this, we have to understand that every gene we are inheriting from our parent. See that what I'm saying, every gene we are inheriting from our parent will be having two alleles. So every gene will be having two alleles, one allele from the father paternal side and one allele is derived from mother maternal side, right? So every gene is having two allele, one is paternal, one is maternal, right? So this is the normal thing which we see in our human genome, right? And out of these two, when we are seeing a chromosomal structure, suppose I am showing you this chromosomal structure, right? This is the chromosome and this is just a schematic diagram for understanding, right, about genomic imprinting, what happens, right? So this is a chromosome. On any chromosome, when we are looking at any gene, suppose I am talking about two genes, gene is A and second gene is B, right? So A gene and B gene. So this A gene will be having two alleles, right? As we have discussed, they are having two allele. One will be paternal allele. This is the paternal chromosome, this is the maternal chromosome, right? Paternal chromosome and maternal chromosome. So every gene, so here I am showing you A gene and this A gene is having two allele, paternal allele and counterpart is maternal allele. So paternal and maternal, both type of alleles for the same gene, right? So for this same gene we are seeing paternal and maternal allele. So every gene is having two allele, one from the paternal side, one from the maternal side, right? Similarly, we will be also having two genes, right? One on paternal, one on maternal, paternal allele, maternal allele, right? So what is genomic imprinting? Genomic imprinting is inactivation of gene or inactivation of one allele, either maternal or paternal. So what happens in genomic imprinting? There will be inactivation of one of the allele. For example, just for example, I am going to demonstrate here. When we are seeing this, right? When we are seeing this and say it is paternal allele which is imprinted. So now I am showing you in this case paternal allele is having imprinting. Imprinting means inactivation. So paternal is imprinted. So what is functional? In this case maternal is functional. Maternal is functional. Same way, when we are talking about the B, assume that in this case maternal is inactivated, right? So in this maternal allele is imprinted or inactivated, but paternal allele is functional. So paternal allele is functional. So this is the perfect picture to describe genomic imprinting, where we can see functional allele is from one parent is having imprinting, right? So mean to say that functional allele is derived from one parent, or we can say that one of the allele will be imprinted on the chromosome. So this is called differential inactivation of the gene. or differential imprinting of the gene, either maternal or paternal, either maternal or paternal. So differential inactivation of either maternal or paternal allele is called as genomic imprinting, right? So how is the definition? So now I am going to define this, which was the question in All India exam. Definition of genomic imprinting. Definition of genomic imprinting is differential inactivation. Differential inactivation. See what I was saying, inactivation or imprinting you can say, right? Inactivation is the meaning of imprinting. So differential inactivation of whom? Differential inactivation of either maternal or paternal alleles, right? So either maternal or paternal allele. So this is the perfect definition of the genomic imprinting, right? Differential inactivation of either maternal or paternal allele, or in simple word we can understand, functional allele will be inherited from one parent only. This is the another simple definition we have to understand. So this is another definition we have to keep in mind. This is the another definition. This is one definition, or we can define like this. Okay, functional gene is inherited from, or functional allele, I should say functional allele is inherited from one parent only. So functional allele is inherited from one parent only, right? So this is the another definition of genomic imprinting. So same thing, differential inactivation of either maternal or paternal means functional allele is from one parent, right? As we have seen in that chromosome description also. So this is the point which I wanted to tell you. This is the normal phenomena. This will affect certain genes of certain chromosomes, right? So as I said in the beginning, these are the normal phenomena. So genomic imprinting is a normal entity or normal thing which is happening in our genome, which will be involving certain genes, right? So this will involve certain genes on certain number of chromosomes. So that is the important thing we have to understand. Okay, genomic imprinting is a normal phenomena which is happening in our genome, which will involve certain genes of certain chromosomes, but they may be associated with the defect in genomic imprinting, may be associated with the disorders, which we will later discuss on. Now what I want to ask here, which examiner had asked in AIIMS exam also, what is the mechanism of genomic imprinting? What mechanism is responsible for this differential inactivation or imprinting of gene? So now we are going to see what is the mechanism of genomic imprinting, right? So what is the mechanism of genomic imprinting? And that was the question in AIIMS exam. Mechanism of genomic imprinting is the epigenetics. So that was the answer. Epigenetics is the mechanism of genomic imprinting. So epigenetics is the mechanism of the genomic imprinting. Now question comes to our mind, what is epigenetics? What is epigenetics? So epigenetics is defined as hereditary modifications of DNA or histone protein. So hereditary chemical modification. So what is this? These are defined as hereditary chemical modifications. Chemical modification. So hereditary chemical modification of DNA or histones. So this is the definition of the epigenetics. So now we are seeing what is the definition of the epigenetics. Epigenetics is defined as hereditary chemical modification of DNA or histone. Now question comes to our mind, what kind of chemical modifications? So what kind of chemical modifications are going to involve DNA or histones, which will cause genomic imprinting or inactivation of the gene or reduced expression of the gene, right? So now we are going to see what are these chemical modifications. These chemical modifications are methylation of DNA or histones, right? So methylation of DNA or histones. So this is the chemical modification. So always keep that in mind. Methylation of DNA. This is the most common mechanism of epigenetics. Most common mechanism of epigenetics is methylation of the DNA. Remember, it is not only methylation of the DNA, it can be methylation of histone also. It can be methylation of histone. So there are various methods. It is methylation of histone or DNA, and it can be because of deacetylation of histones also. So these are the two basic mechanisms which we have to keep in mind for future exam also, right? So methylation of DNA or histone and deacetylation of histone will inactivate them, right? Deacetylation. So that is also one important thing we have to keep in mind. Deacetylation of histones will inactivate or cause genomic imprinting, right? So genomic imprinting is because of deacetylation of histone also, but most common mechanism, if examiner says, your better answer should be methylation of DNA, right? So whenever this will happen, methylation of DNA or histone or deacetylation of histone, so what will happen? What will happen to the expression of gene? That was the question in older AIMS exam. In 2013, there was a question. If there is a methylation of DNA at cytosine, what will be expression of gene? Increased expression or decreased expression? Right? So that time we have to remember this will cause reduced expression of gene. Reduced expression of genes because genes are getting inactivated or imprinted, right? So that is the basic mechanism of genomic imprinting. Epigenetics, chemical modifications, hereditary. What kind of chemical modification? Methylation or deacetylation. Methylation is the most common mechanism, right? And when they will be doing all these things, what will happen to the resultant overall expression of the genes? That will be reduced, right? Expression of genes will be reduced. Expression of gene is reduced, and that was the question in AIMS exam, right? So there will be reduced expression of genes, right? So that was the question in AIMS exam, right? So we have read about mechanism also. So mechanism is epigenetics. Because of epigenetics, there will be reduced expression of the genes. So these are the some basic outline. So now we are going to deal with the disorder. As I said, ki abnormal genomic imprinting is associated with some disorder. So what disorder we are going to discuss? So chromosome number, when we will see chromosome number 15 long arm, 15 long arm, this is associated with two named disorders which we are going to discuss, where you will find there is a role of abnormal genomic imprinting, right? So what are these disorders? These disorders are Prader-Willi syndrome, Prader-Willi syndrome, right? And second is Angelman syndrome, Angelman syndrome. So these are two disorders which are associated with abnormal genomic imprinting, right? So in future, when I will be writing, I will be using short form. For Prader-Willi, I will be writing PW, and for Angelman, I will be writing AM, right? So they are because of abnormal genomic imprinting in chromosome number 15 long arm, right? So that is also one important MCQ which we have to keep in mind. So now we are going to see what is the molecular basis of these two syndromes. So now I am going to discuss about molecular basis of these two syndromes. Molecular basis, right? So what is the molecular mechanism in development of these two disorders? Molecular mechanism consists of three important mechanisms, right? Molecular mechanism consists of three important mechanisms. Number one and the most common is deletion. Number one and the most common one is the deletion, which will be responsible for 70% of the Prader-Willi and Angelman syndrome, right? Second most common is uniparental disomy. Second is uniparental disomy. Uniparental disomy is responsible for 15 to 20% of the cases, right? Uniparental disomy will be responsible for 15 to 20% of the cases. And the third one is abnormal genomic imprinting. Abnormal, see what I have written, abnormal genomic imprinting. So normal genomic imprinting, as I have discussed, right? So always keep that in mind. Genomic imprinting is normal, and when we are seeing abnormal genomic imprinting, they may be associated with Prader-Willi syndrome and Angelman syndrome. So we were discussing about Prader-Willi syndrome and Angelman syndrome, and now we are going to see their role, genomic imprinting role in development of these disorders on chromosome number 15. Arm is the long arm, Q, right? So now we are going to see this deletion, right? Here I will give you example of a chromosome. This is the chromosome. Chromosome short arm is P, long arm is Q. Short, long arm, right? As we know that Prader-Willi syndrome and Angelman syndrome, they are both on same chromosome and long arm. So long arm Q will be affected, right? Long arm Q will be affected. So here I'm going to show you two types of genes. As I have already discussed you, there is a one gene called A, and as I have told you, every gene will be having two alleles. One will be on paternal. So suppose this is the paternal chromosome and this is the maternal chromosome, right? So same way, this A will be having one is called paternal allele, this is the paternal allele, and this is the maternal allele. So these are the alleles, right? So these are the two alleles. So every gene will be having two alleles, one from the father, one from the mother, right? Similarly, I am also making one more, that is called B gene, right? This B gene is again having two alleles, right? One is present on chromosome number 15, father, so paternal allele, and this is again maternal allele, right? So this is one basic introduction. I am again repeating that so that we can understand this concept more comfortably, right? So in this case, now what we are going to see, if deletion is there, how this deletion is associated with genomic imprinting, which is responsible for Prader-Willi and Angelman syndrome, right? So in normal condition, what we have read, suppose this maternal was imprinted. Suppose this maternal is imprinted. So what I am showing you, this is the normal thing, right? Maternal is imprinted. So functional gene is from father side, right? So this is the normal phenomenon. That's what we have discussed. Okay, one allele will be imprinted, one allele will be functional. So suppose this functional allele is getting deleted. Suppose this functional allele means paternal allele. Suppose I want to show that this paternal allele is deleted, right? So in this I am showing you paternal. Suppose I am showing you this paternal allele is having deletion. So paternal allele is having deletion, right? So paternal is having deletion. So this is the mnemonic sort of thing also. Whatever gene, whatever allele will be deleted, mnemonic will be based on that. Allele deletion will be mnemonic. Paternal deletion, Prader-Willi syndrome. Paternal deletion, Prader-Willi syndrome. So whatever allele is getting deleted, that will be giving mnemonic. So paternal allele deletion is giving rise to which disorder? Prader-Willi syndrome. So this is how we will see Prader-Willi syndrome. So what we are observing in Prader-Willi syndrome, in nutshell, if I wanted to write what will happen in Prader-Willi syndrome, who is deleted? Paternal deletion. Who is imprinted? Maternal imprinting. So that is how now no functional gene is present. So this is how we have to understand, right? In Prader-Willi syndrome, paternal allele is having deletion, maternal allele is having imprinting, right? So this is the summary of the Prader-Willi syndrome. Paternal allele is deleted, maternal allele is imprinted, and Prader-Willi patient, this is Prader-Willi patient, right? Now look at the another case where we are seeing in this scenario, this B gene. Suppose I am showing you this paternal allele. See, This is the paternal allele, and paternal allele is having imprinting. So in this, what I am showing you, paternal allele is having imprinting. But when we are talking about maternal allele is having deletion. So here you are seeing maternal allele is having deletion, right? So when maternal allele is having deletion and paternal is imprinted, so obviously there is no functional allele for the gene also. So this will be giving rise to disorder. What is name of this disorder? So see what I have said, whatever allele is getting deleted, mnemonic will be following that. Maternal deletion, mothers are angel. Maternal deletion, mothers are angel, Angelman syndrome, right? So in this case, this is called Angelman syndrome. So when we are seeing maternal deletion, this will give rise to Angelman syndrome. So this is Angelman syndrome. What happens in Angelman syndrome? As I said, Angelman syndrome, you can see there is a maternal allele deletion and paternal allele is having imprinting, right? So this is the finding in Angelman syndrome. Maternal allele deletion, paternal allele is imprinted. This will be giving rise to Angelman syndrome, right? So now we will see some of the salient features of the Prader-Willi and Angelman syndrome, right? Prader-Willi and Angelman syndrome. In Prader-Willi syndrome, this patient will be having obesity and he will be mentally retarded. So obesity, mental retardation. Why he is obese? Why is obese? Because he is having more craving for the food. Why there is more craving for food and why he is eating more? Because one hormone is very high in this patient, which was the All India question in 2012, ghrelin, right? So this is the question in All India exam, ghrelin hormones. Ghrelin hormones. What are ghrelin hormones? That was the question. What are ghrelin hormones? So ghrelin hormone is an orexigenic hormone. What is this? These are an orexigenic hormone. That was the answer in All India exam. Orexigenic hormone. What do you mean by orexigenic hormone? These are those hormones which will increase the appetite of an individual, right? So this will increase appetite of an individual. So that was the right answer. So ghrelin hormones are orexigenic hormone. This was the question in All India 2012, right? So this ghrelin hormone is usually secreted from which part of the stomach? So these are secreted from the antrum of the stomach. So source of this ghrelin hormone is antrum of the stomach. So more ghrelin hormone will be released. So ghrelin hormone level will be very high in case of Prader-Willi syndrome, right? That is why this patient will be craving for food and he will be having more appetite, and that is why he is obese. So he will be obese, mentally retarded, because of the obesity reason is the ghrelin hormone is more, appetite will be more, he will be fond of eating, and apart from this he will be having hypogonadism also. He will be having hypogonadism also. So these are the some of the important findings you will see in Prader-Willi syndrome, right? But when you compare this with the Angelman syndrome, now you compare this with Angelman syndrome. Look at this Angelman syndrome. Angelman syndrome, if you see, what is the nickname of Angelman syndrome, right? Nickname of Angelman syndrome, she is also called as happy puppet syndrome. Happy puppet syndrome. Why it is called as happy puppet? Why it is called as happy puppet? Because of inappropriate laughter. Inappropriate laughter, right? So this type of patient will be having inappropriate laughter, number one. Why it is called as puppet? Because of the ataxic movement, right? Because of the ataxic movement, right? So ataxic movement, inappropriate laughter is the basic reason for this name called as happy puppet syndrome. So Angelman is happy puppet, inappropriate laughter will be there, ataxic movement will be there. See what I want to tell you here, future question. See, ghrelin hormone will be increased in Prader-Willi, Angelman, or both. So that time we should remember that ghrelin hormone will be really increased only in case of Prader-Willi syndrome. It will be normal in case of Angelman syndrome. So ghrelin hormone will be normal. Ghrelin hormone will be normal ghrelin hormone level, right? So ghrelin will be normal in case of Angelman syndrome, right? So now we can see how deletion is important in development of this Prader-Willi and Angelman syndrome. This is the most common molecular mechanism for these two syndromes, and now you can see how this genomic imprinting along with the deletion is associated with development of this disorder, right? So this is about genomic imprinting. Now we will see another mechanism. Look at this name, uniparental disomy. If you remember, when autosomal recessive discussion, I told you uniparental disomy. So this name itself is a mnemonic, right? One parent giving two chromosomes. That's all. One parent is giving two defective chromosomes, and that is why this disorder will develop. So now we will see uniparental disomy. Also, we can divide them into two broader categories. Uniparental disomy of the maternal chromosome or paternal chromosome. So these are the two older questions in AIIMS exam, right? Uniparental disomy of maternal or paternal chromosome. This question had been asked earlier in AIIMS exam also. So when there is a maternal chromosome uniparental disomy, so what does that mean? So now we will see. We will try to understand uniparental disomy of the maternal chromosome. Suppose I am showing you this is the cell, right? And in this cell there are two chromosomes, right? There are two chromosomes, right? And what is the meaning of uniparental disomy? Uniparental disomy means both are from one parent, and in this case parent is mother, right? So both are maternal. So both are maternal chromosome, right? So that is the meaning. Uniparental, one parent has given both the chromosome, and here in this case it is mother. So mother has given both the chromosome. So this will behave like a deletion of the father, right? This is deletion of paternal chromosome. So if there is a deletion of paternal chromosome, paternal deletion is Prader-Willi or Angelman? Paternal deletion, because both are from mother. So it is behaving like a paternal deletion. So when this is behaving like a paternal deletion, this will be called as Prader-Willi syndrome. So that is how we will see Prader-Willi syndrome. So this point is very, very important when examiner asks you question like this. Okay, there is a uniparental disomy of the maternal chromosome. Which disorder you will find? See this uniparental, one parent is giving both the chromosome, and that is mother. So it is like a deletion of father. So Prader-Willi syndrome. Same way, uniparental disomy, one parent, two chromosome, and that is father. So both are from father. So it is a like a deletion of mother. So mother deletion, mothers are angel. So like that we can understand. So in this case, both chromosomes are paternal in origin, right? Both chromosomes are paternal in origin. So they will be behaving like a maternal deletion. So this will be maternal deletion is Angelman syndrome, right? So this is how uniparental disomy is associated with Prader-Willi syndrome and Angelman syndrome. Uniparental disomy of maternal chromosome, this was the older AIIMS question, right? Will be giving rise to Prader-Willi syndrome. So that is how examiner will be asking maternal chromosome Prader-Willi question, right? So future question will be paternal chromosome will be giving rise to Angelman syndrome. So this is how we have to keep that in mind, how future question can be asked from this very important topic of the genomic imprinting. Coming to the abnormal genomic imprinting. Abnormal genomic imprinting, what does that mean, right? So now again I am going to draw that chromosome so that we can understand what is this abnormal genomic imprinting. Suppose this is the chromosome number 15 long arm, right? And this is the A gene with two alleles. As I said, every gene will be having two alleles, one on the paternal chromosome, one on the maternal chromosome. So this is the paternal and this is the maternal allele, right? Same way as we have discussed earlier, the B gene is there and they will be also having paternal allele. So every gene will be having two allele, one from the father, one from the mother. Same thing we have seen, right? Same again, I am going to repeat that. In this case, maternal imprinting is normal, right? So in this case, this is normal thing which we are seeing, one allele will be imprinted, one will be functional, normal. Similarly, you can see here paternal is imprinted and maternal is functional. So this is normal genomic imprinting. What I have shown you here is normal genomic imprinting. But suppose this normal functional paternal allele is getting imprinted, because see, this is normal, it should be functional, but suppose this is the abnormally imprinted. So now I am going to show you abnormal. So this is having abnormal imprinting. So when they are imprinted, this will be abnormal imprinting. Same rule, paternal imprinting, Prader-Willi syndrome. Right? So this is how we can see that normal imprinting one will be functional, but when the remaining normal paternal is also imprinted, they will be giving rise to Prader-Willi syndrome. Same way, in this B gene, if you see, paternal imprinting is the normal, one functional is from the maternal, but just imagine this B, that functional is again getting imprinted. So maternal allele is getting imprinted, so this is called abnormal imprinting, right? And this abnormal imprinting of maternal allele will be giving rise to maternal, mothers are Angelman syndrome. So this is how we can see abnormal genomic imprinting is associated with, how they are associated with Prader-Willi and Angelman syndrome. So now we can understand by seeing this discussion how genomic imprinting is associated with all Prader-Willi syndrome mechanism, right? Now here I want to discuss little bit of the uniparental disomy, where examiner had asked question in AIIMS exam 3 times, right? Uniparental disomy is associated with, that was the question in AIIMS exam, uniparental disomy, this is the abbreviation of the uniparental disomy. Uniparental disomy is associated with, so 2 syndromes we have seen, Prader-Willi, Angelman, right? These are 2 syndromes. There was third, which is one more syndrome we have to keep in mind, that is Russell-Silver syndrome. That is Russell-Silver syndrome, right? So when you will open Harrison, in Harrison you will find this name, which was given in AIIMS exam also. So these are the 3 names which examiner had asked: Prader-Willi, Angelman, Russell-Silver syndrome. So they are associated with uniparental disomy. So there is one more thing which we have to keep in mind, Beckwith-Widman syndrome. Beckwith-Widman syndrome. So Beckwith-Widman syndrome is also associated with uniparental disomy. So Beckwith-Widman syndrome is also associated with uniparental disomy, and this is associated with Wilms tumor gene type 2, right? So that is the important thing, right? Wilms tumor gene type 2 is associated with Beckwith-Widman syndrome. So this is how we are predicting a future question, right? Wilms tumor type 2 gene is having uniparental disomy. Which of the following syndrome you will expect? Wager syndrome or Beckwith-Widman syndrome or Danish-Grass syndrome? So now you know it is Beckwith-Widman syndrome which is associated with uniparental disomy because of WT2 gene uniparental disomy, right? So this is about genetic or genomic imprinting, right? Now we will move to the last unclassic inheritance, which is trinucleotide repeat mutation. So trinucleotide repeat mutation, the 4th unclassic inheritance. Another important topic where examiner asks question, trinucleotide repeat mutation. Here what we need to understand, the word mutation usually stands for loss of gene, right? But here there will be trinucleotide repeat, and because of trinucleotide repeat there will be gain in gene. So when there is a gain in gene, that kind of mutation is called as dynamic mutation. So that is why trinucleotide repeat mutation is also known as dynamic mutation. So this can be future question, right? This is how it has been given in Harrison, right? So we have to keep this in our mind. Dynamic mutation is another name for the trinucleotide repeat mutation, right? So trinucleotide repeat mutations are also known as dynamic mutation. Here we have to understand some of the basics which we have learned in our biochemistry also. Whenever we are seeing any codon, right? Codons are normally, when we are talking about normal codons are arranged in triplet. For example, C, G, G. So they will be arranged in triplet like this, right? and these triplet, they will repeat themselves. That is another normal thing. So these triplet will have repetitions. So there will be repeats. How many times are normal repetition? Because we are talking about normal event, right? So normally codons are arranged in triplet and they will repeat themselves from 6 to 55 times, right? So 6 to 55 times repeat is the normal number of repeats, which is on an average. When you will see the average value, it will be approximately 30 repeats, approximately. So approximately 30 times of repetitions are common or normal in a normal codon, in a normal human genome. So in a normal human genome, 6 to 55 times means up to 30 times of repeat is the common or normal things, right? So this is the normal codon arranged in triplet and they will repeat themselves for approximately 30 times on an average, or range will be 6 to 55 times. But if they go beyond 55 times, then what will happen? That will be called as trinucleotide repeat mutation. So when number of repeats are, when you are seeing number of repeats are more than 55 and it's limited up to 200. So number of repeat is 55 to 200. This type of thing will be called as trinucleotide mutation. When we are seeing repeats from 55 to 200, these are called as pre-mutation, and that was the All India question, right? Pre-mutation is associated with which of the following condition? Trinucleotide repeat mutation. So that was the question in All India exam. Pre-mutation is associated with trinucleotide repeat mutation. What is pre-mutation? In this, patient will be like a carrier and he will be asymptomatic. Patient will be like a carrier and he will be asymptomatic, right? So patient will be like a carrier and he will be asymptomatic. So repeats are 55 to 200. These are pre-mutation, means patient will be not showing any symptom. So when they will show symptoms? When number of repeat will be more than 200, right? So when number of repeat is more than 200, when number of repeat is more than 200, so more than 200 repeats will be responsible for overt disease, right? So overt disease will be expressed when number of repeat will be more than 200, right? So when number of repeat is more than 200, there will be clear-cut disorder in this kind of patient, right? So now we are observing one important thing. When number of repeats are getting increased, severity of disorder is also getting increased, right? So that was the question in All India exam. There was one statement that number of repeats will correlate to the severity of disorder, which was correct statement, right? So here we have to understand this point that number of repeats is directly proportional to the severity of the disorder, right? So now we can see that severity of the disorder is directly proportional to the number of repeats, right? So whenever you find there is an increase in number of repeats, severity of the disorder will be also increased. So that was the statement in All India exam, which was a true statement. Number of repeats is directly proportional to the severity of the disorder, right? Now the question comes to our mind, when this number of repeat will increase, during oogenesis or spermatogenesis, or both? So that is how examiner will be asking question, number of repeats will be increased in which condition, right? So here you can see there is an increase in number of repeats. Number of repeats will be increased during oogenesis also, and this will be increased during spermatogenesis also. So oogenesis and spermatogenesis, in both conditions number of repeats will be increased. In both conditions number of repeats will be increased. So during oogenesis, another important area where examiner is focusing nowadays, oogenesis will be involving exonic areas or entronic areas. So that is important, right? During oogenesis, they will be involving non-coding areas. They will be involving non-coding areas, and we all know that non-coding areas are also called as introns, right? So their target is introns, whereas in spermatogenesis they will be targeting coding areas, and we all know that coding areas are called as exons. So that is another important area which examiner is asking nowadays in exam: introns and exons, right? Oogenesis and spermatogenesis. So oogenesis will be involving intronic areas, spermatogenesis will be involving exonic areas. So what are the examples? What are the examples of oogenesis non-coding areas? Examples of oogenesis non-coding area, examples are: number one is myotonic dystrophy. Myotonic dystrophy. Myotonia dystrophica or myotonic dystrophy, they are associated with chromosome number 19, which was the All India question previous year. So this point also we have to keep in mind. This was the question in All India exam previous year. Myotonia dystrophica is associated with chromosome number 19, long arm, right? 19 long arm is associated with myotonic dystrophy or myotonia dystrophica. So this is number one disorder which is associated with the oogenesis trinucleotide repeat mutation. Second disorder is the Fragile X syndrome. Fragile X syndrome. And third disorder is Friedreich ataxia. Friedreich ataxia. Right? So these are the three important disorders: myotonia dystrophica, Friedreich ataxia, Fragile syndrome. All these are oogenesis trinucleotide repeat mutation disorder. What about the spermatogenesis? In spermatogenesis trinucleotide repeat mutation disorder, number one and most important is the Huntington's chorea or Huntington's disease. So Huntington's chorea or Huntington's disease is number one example. Another example is the spinocerebellar ataxia. Spinocerebellar ataxia, right? So spinocerebellar ataxia is the another example during spermatogenesis. So these are the trinucleotide repeat mutation, right? So these are the trinucleotide repeat mutation examples: exonic areas and intronic areas, right? So here I would like to give you one example, right? I'm just taking one example for your understanding point of view, and that example is of the Huntington's disease, right? So that is about Huntington's disease. Huntington's disease is because of the increased trinucleotide repeat in CAG trinucleotide. This is one important MCQ. And because of this CAG trinucleotide repeat mutation, they will develop disorder, right? And these disorders are actually autosomal dominant disorders, right, which will be having trinucleotide repeat mutation. So they are autosomal dominant disorder, trinucleotide repeat mutation will happen, and this is happening on chromosome number 4. So chromosome number 4 is the area where Huntington disease is located, right? So these genes are located on chromosome number 4, where CAG trinucleotide repeat will be more. Usually Huntington disease is diagnosed by the age of 40 to 60 years. So older age disorders, right? So 40 to 60 years. So these are the some basic introduction about Huntington disease. In this, what I wanted to tell you, suppose I am taking one example of the father. Suppose this is the father, and he was having 300 trinucleotide repeats. So he was having 300 trinucleotide repeats, right? And he has contracted this disorder by the age of say 40 years, right? So onset was at the age of 40 years. So father was having Huntington's chorea, diagnosed at 40 years, and when he was diagnosed, he was having 300 trinucleotide repeats. So during spermatogenesis, this trinucleotide repeat has been increased. As a result, his son, now his son is having, say, example is 600 repeat. Suppose his son has got 600 repeats. 600 repeats. So what will happen to the severity of disorder? If father is having 300 repeat and son is having 600 repeat, so as we all know that the severity of disorder will be increased, right? Severity of disorder will be increased, And another interesting point, this patient, this son will be contracting this disorder at earlier age, say 25 years, right? Say 25 years. So in this example, what I want to show you, in this example of Huntington chorea, what I want to show you, if father was having 300 and age was 40 years when he was first diagnosed, right? But when his son was born, and his son will be detected this same disorder at the age of 25 years, but his severity will be more because number of repeats are more. What is this known as? So this is important MCQ in All India exam. What is this known as? This is called anticipation, right? So anticipation is associated with trinucleotide repeat mutation. That was the question in All India exam. Anticipation is associated with trinucleotide repeat mutation. Anticipation is associated with trinucleotide repeat mutation. So this is the important thing which we have to keep in our mind. What is anticipation, right? What is anticipation? That was another All India question. What is anticipation? Anticipation is increased severity of the disorder. Increased severity of the disorder, number one. And number two is early onset of the disease. Early onset of the disease. So what is anticipation? Increased severity of the disorder and early onset of the disease in next generation. In next generation, right? So this is called as anticipation. So this definition had been asked in All India exam, what is anticipation, and option was only given that increased severity of the disorder in next generation is called as anticipation. But what can be the future question? Is it severity of the disorder or is it early onset also? So that time we have to remember both should be happening in next generation, right? So increased severity, early onset of the disease in next generation is called as anticipation. Anticipation belongs to trinucleotide repeat mutations like Huntington's chorea or maybe in Fragile X syndrome, right? Now here I would like to tell you some important point about Fragile X syndrome also. Fragile X syndrome, a very important topic which had been asked in All India and PGI both exam. Why this is called as Fragile X syndrome and what is the pattern of inheritance? Fragile X syndrome, basically they are X-linked recessive disorders, right? They are both X-linked recessive and dominant, but when examiner asks you which is most common, you know that X-linked recessive is most common. So who will be most commonly affected? Males, right? So males are more commonly affected than females, right? Fragile X syndrome, why the name is given Fragile X syndrome? Because these patients, when you will see the chromosome, chromosome will be having fragile sites. This was the statement given in PGI exam. So chromosomes are having fragile sites, that is why it is called as Fragile X syndrome, right? And these fragile sites will become more prominent when you are growing them in folate deficient medium. So when you are growing these chromosomes in folate deficient medium, fragile sites will become more prominent, and that is why name has been given Fragile X syndrome, right? Fragile X syndrome, what are the clinical features you will observe in this patient? What are the clinical features? Clinical features in this patient will be, number one, they will be having mental retardation. One of the common cause of mental retardation. Remember, these are one of the common cause of mental retardation. These are the one of the common cause of mental retardation. Mental retardation, right? And mental retardation in this patient, IQ will be ranging from 20 to 60. This was the question in this All India exam, right? In this All India exam, question was mental retardation will be of the range of 20 to 60 in males. See what I have said in the beginning, they are X-linked recessive, so males are commonly affected. So that was a true statement. Males will be affected, IQ will be in the range of 20 to 60. This was the All India question this time, right? So now you can see that these topics which are frequently asked in any exam, we must revise them before going to exam, because definitely some question is going to be asked from here. These are called high yielding topics, and this entire unclassic inheritance is a high yielding topic for any exam, right? So mental retardation will be there, IQ will be ranging from 20 to 60. What is the most characteristic finding? When examiner will be asking you what is the most characteristic finding? Most characteristic finding in Fragile X syndrome is macroorchidism. Macroorchidism means large testis, right? So this patient will be having large testis. So large testis is the most characteristic finding in case of Fragile X syndrome. So this can be also a important question in future exam. Already it has been given in option. Okay, in Fragile X syndrome, usually you will find large testis, as we can see here, macroorchidism. Apart from that, they will be having large face, large ear, right, large mandible. So all these things will be larger in Fragile X syndrome. So that is how question had been asked in All India exam 2016 and AIMS older exam. Okay, what about the nose? Nose will be normal or small, right? So it will be not large. So that is the important point which we have to understand. Okay, in case of Fragile X syndrome, nose will be normal or small. So it will not be increased or it will not be enlarged, right? So these are important point about Fragile X syndrome. So this trinucleotide repeat mutation we have covered, and we have seen all 4 important unclassic inheritance disorder. And as I said, these are high yielding topic. In last month of your preparation of exam, you must revise these topic. You will definitely get some question from here. It's a high yielding